Awesome. So, hi everyone. Thank you for joining us this afternoon for our Rare Disease Day patient panel. My name is Sarah, and I'm excited to introduce to you our panelists for today. So we have Meridith O'Connor, Jenica Leah, and Jessica Hanson. So before they introduce themselves, I want to quickly go over a few housekeeping notes. So for the first 30 to 40 minutes, I will be asking the panelists questions regarding Rare Disease Day and their unique experience living with a rare disease. So feel free to populate any questions you may have in the chat, and we'll do our best to answer them later on during our Q&A session for the last 15 minutes or so. And if for some reason we don't get to every question, you can always email us afterwards. And last thing, please make sure you are muted. We would appreciate that greatly. So without further ado, let's get started. So first, if each panelist wants to introduce themselves, share a little bit about their journey living with a rare disease, that would be great. So let's get started with Jenica.
Okay, thank you. Thanks everyone. Hello, thank you for joining. So my name is Jenica Leah. I live with sickle cell anemia. I have been known as a trailblazer when it comes to creating kind of resources that educate people about sickle cell and spread awareness. So I first started doing that in 2016 when I wrote my first children's book. There are now 2 books in the series. The series is called My Friend Jen, and it's all about empowering younger children that live with sickle cell to give them the confidence that they can speak about their condition openly. And it's also about spreading awareness among adults and other people who have no clue what sickle cell is, to give them a basic understanding of sickle cell. It's a blood disorder that affects the hemoglobin in my red blood cells. It's a genetic condition, so I was born with it. And it's actually something I tend to use the phrase, something that enabled me to turn my pain into passion and my passion into a purpose. So I now do everything around kind of sickle cell. I created a whole business around it, and I really enjoy speaking about it. You know, it's a part of my life. So I'm able to kind of portray that and share that with the world.
Thanks, Jenica. We're so excited to hear from you throughout the panel. And next we'll have Meredith, if you want to introduce yourself.
Sure. Thanks so much. And hi, everybody. So nice to be here and be with you all on Rare Disease Day. I'm Meridith O'Connor. I consider myself a patient advocacy specialist, and I advocate for the neuromuscular rare disorder myasthenia gravis. And if you're not familiar, myasthenia gravis is a neuromuscular condition that affects my chewing, my swallowing, smiling, seeing, limbs, general weakness and fatigue throughout the body. I was diagnosed in 2005, misdiagnosed for 2 years. And I like to say my advocacy journey started during those years of misdiagnosis, and I was only 10 years old at the time. So I have been doing this for quite some time. It's been a part of my life. MG has been a part of the majority of my life. And I have, like Jenica, used it, taken this pain and put it into purpose, if you will. And I have also sort of developed a career around it. I've developed so many skills and gained so much knowledge over the years, working with doctors and other patients and, you know, different support systems. And I wanted to bring that all together and share that with the community at large. I'm in St. Louis, Missouri. My background is in social work and psychology. And so I use that also to inform, you know, how I work with different populations. I do a lot of writing, speaking, and consulting. So whether it be blogs or public speaking engagements, consulting work. I work with a lot of bio and pharma tech companies now many that are interested in looking to incorporate the patient experience into drug development, which is huge. And so trying to get more involved with that as well. So lucky to be here, happy to be here. Thanks so much.
Thanks, Meredith. Last but not least, Jessica.
So my name is Jessica. I was first diagnosed with celiac disease almost 11 years ago, and very quickly became an advocate within that community and started connecting with a lot of people and speaking out about holes in different regulations and things like that. So I more recently got involved after I was diagnosed with Graves' disease and thyroid eye disease. So then I started to get more involved in those communities. And I just really love connecting with people in different communities because I think that there's a sense of feeling very alone when you're diagnosed with an autoimmune condition or chronic illness or rare disease. And one of the things that I do is I'm an organizer for the NYC Celiac Disease Meetup group. And it's just so wonderful to connect with other people and find the instant recognition and empathy and understanding with other people who are just going through something similar. So I'm really happy to be participating in this panel today and be here with so many wonderful advocates.
Thanks, Jessica. All right, so I think we're ready to get started. So this can definitely be conversational. Of course, we want to hear from everyone. And for those listening, we would love for you to also participate by commenting in the chat. So if we ask a question, we would love for you to comment in the chat with your experience as well. So our first question of the day is, what does Rare Disease Day mean to you? As you all know, today is Rare Disease Day, so we thought this was a fitting question to start things off. Does anyone feel passionate about starting this conversation off?
I'll start it off. Yeah. Whenever I think of these days where we have a day of recognition about things, it's wonderful to have more attention highlighted on very specific communities. But I always say that for those of us who have rare diseases or chronic illnesses, you know, every day is Rare Disease Day. But I think that one of the wonderful things that we get to do is to connect with other people in different communities and continue to learn more about each other's experiences, because I think that the more we get to learn about other chronic illnesses and other people who we can support in the community, the kinder the world will be.
100%. I think that's the truth. Yeah, I agree with everything Jessica just stated. And I was thinking about this question a lot. It's really interesting how far we've come in the last, 20 years, but even in the last 10 years. I can remember when I was in college and a friend of mine told me, she goes, "Did you know it's Rare Disease Day?" And I was like, well, no, I had no idea. And so the amount of awareness and education that we have been able to be privy to has been so it's only gotten better and continues to grow. And I think I was telling you all earlier, as I see this day as an opportunity to, celebrate how far we've come, celebrate how far I've come personally, as well as a society with rare diseases, an opportunity to recognize both patients and people, in the community, such as like Sarah and Kristen and everyone that, works hard to make the patient voice heard. And overall, just, like I said, an opportunity to educate the public and bring even more awareness to, not just me, in my myasthenia gravis, but I learn from you all as well, whether that be learning about your diseases or your experiences, and just an opportunity to acquaint, myself with others, and keep learning, keep growing, and keep empowering others to share their voice, because that's really where the awareness begins. And that's where the education begins as well.
That's so true. Definitely the empowerment. And I think, like what both of you have said, just the spreading of the awareness. I was actually looking, so when I found out that Rare Disease Day was a thing as well, because I didn't know many years ago, I was actually surprised that my condition, which is sickle cell, was actually a rare disease, because it actually affects so many people, millions of people around the world. It's the fastest growing genetic disorder and one of the most common ones around the world as well. So I was like, what? So for me, it's kind of like it lets me know that there's still a lot to be done. And I think we all can feel like that. Even, as many conversations as we have, as many things that we share, we always then come across someone who has no clue about, what we've spent, the whole year speaking about. And we're like, oh, here we are again, doing it all again. So it's an opportunity, to kind of push more, to do more. And I also find it really interesting to see the similarities in some of the diseases in terms of like the things that we experience, the mental strain it can cause, the social elements that it can cause. Even though we have different diseases, we actually find a lot in common. And I find it quite interesting to just kind of learn about other illnesses that are perhaps even more rarer than mine, and still we all suffer the same things, so similar experiences. So yeah, it's a good day overall.
Jumping off of that, I think that it's really interesting. Some of my conditions people refer to as rare diseases. And I say, well, I think that statistically they're pretty common, but because of the diagnosis rate, and the diagnosis rate can be really low because many people might be misdiagnosed or go undiagnosed for a long time. The more that we talk about how we find answers and what symptoms are and how to talk with doctors, hopefully the more people will find answers. And maybe someday things will have a lot more resources because they're considered common diseases at that point.
Exactly. It's a progress. Hopefully we'll make it to a common disease. So I wonder if we want to make it there though, because then we don't get to celebrate days like this. So it has its pros and cons.
I hear you. I feel like the rare disease community is very close knit, and so it's kind of like when a song goes mainstream, it's like it doesn't have that same feel anymore with the closeness. But thank you everyone for sharing. All right, let's go to the next question. So advocating for rare disease is challenging. What would you recommend to someone who was either just diagnosed with a rare disease or have yet to be diagnosed?
I'll jump in again. Oh, go for it. Your turn.
Okay, I'll go. I would say it's definitely important to kind of find your tribe. I think that was really important for me. And I would say if you can't find one that suits you, you may want to create your own. Sometimes it's really difficult if you're diagnosed with something that so many people have, or there's so many minor differentiations between like different people that have the same condition, and you may find communities that are just not what you need. Some people like to speak on the phone all the time, other people like to message all the time. People might just like to share each other's stories and then just read other experiences. So I would definitely say just find what works for you, and in doing so, don't always take the worst case scenario as gospel, because sometimes you can, like, if you go to Google and Google something, Google will literally just give you the worst case scenario of any situation, and it can really not be that bad. So I definitely find factual information, but finding a community that suits you or creating one for yourself was key for me.
Yeah, no, I couldn't agree more. I think probably a lot of us who are advocates probably got started in this journey because we couldn't find our tribe, as you said, our people, our finding common ground, especially with living with a rare disease. And so I couldn't agree more. And I think, the first things first is that, it's easy to doubt yourself. It's easy, at least for me, when I was getting diagnosed, there was so many people telling me it was all in my head, or that I was, had other diagnoses, or that I was making stuff up. So I think first, your gut, stay in tune with, who you are, and trust yourself. There's a lot of people, I think, that, I would say prepare yourself for a lot of dismissal. But that being said, don't give up, keep trying, keep going. Surround yourself with people who are willing and wanting to support you. Because, once you expand and engage with your network, it's so empowering to talk to someone who is going through the same thing you are, or maybe even not, maybe just going through a diagnostic journey or a rare chronic illness. Maybe it's not yours, but regardless, finding people, surrounding yourself with people who get it, educating yourself. I couldn't stress that enough. Educating yourself with credible resources, Like you said, Google and social media even sometimes can be a ground for complaints or worst case scenario. And so you have, especially when you're, going through the diagnostic process or starting your advocacy work, it's being aware, having that awareness and knowing that you have to take everything with a little bit of grain of salt.
I think that all of this is just so important, finding correct information, not jumping to worst case, and finding your community, all so important. One of the things that I like to talk about as well is the different types of advocacy. We advocate for ourselves and we advocate on behalf of the community, and there's a lot of crossover in between. But especially for people who are just diagnosed, I know how overwhelmed I was when I first got my diagnosis. And I think it's really important to remember that it's okay to take care of yourself first, because you can't fully give all of your energy to the community and then have nothing left for yourself. So safeguard your heart and your mental well-being and your physical well-being. I know that I made a choice recently because I've gone through 3 surgeries recently for thyroid eye disease, and I was pretty open about them online, but photos are really triggering for me. And so I just couldn't post pictures of myself throughout that process. And it was just something that I had to do for myself. I had to ask, how much can I give and how much do I need to take care of myself? So today is the first time where I am like digitally making an appearance. So like already I'm feeling a little bit nervous, but it's my jumping back into that component of advocacy. There we go.
And you have a cute new haircut.
I know.
Well, we're glad you're back out there. But I hear you. I mean, yeah, you have to, know your boundaries and keep your cup full. Good energy and good people around you. So moving on to the next question. What's one thing you wish the world better understood about your condition? So I'll let Meredith start this time.
Oh man, a lot of people ask me this question, and it's a tough question for me to answer because there's so much I want people to know. And I try to think of analogies or, metaphors that people can relate to, but I specifically for myasthenia gravis, living a life with myasthenia gravis is very difficult from day to day, hour to hour, minute to minute. It's very unpredictable. You don't know what to expect. So it makes your life difficult, whether that be a career choice, a relationship status, a social group, an event, having family members understand all those social, economic, political things. Those are all, affected by myasthenia gravis. And I always ask people to have a little patience, a little compassion, and have an open mind. Not everything is so black and white, and nothing ever since myasthenia in my life has been black and white. It's always been thinking outside the box and trying to navigate a world that isn't made for you. And with that, I always try to share, those lessons I've learned, and the hard way. It's usually me going through things and having to advocate for myself. But, I'd rather do that than have someone else go through any of the struggles that I did. Not to say that I can prevent them all, but I would say that myasthenia gravis is very unpredictable. It's not only physically exhausting, but it's emotionally taxing. It has challenged me in so many ways, more ways than I ever wanted or predicted. And it still does, as I've had this disease since I was, like I said, about 10 years old. And so this disease has been with me through all the different stages of my life and will be. And learning how to navigate that is difficult. But like I said, I just ask the able-bodied community and those who don't have myasthenia gravis to educate, engage, and empower. We're all here. Don't judge a book by its cover. Some of those, those old sayings, but it's true. You don't know the next person is going through. And so we all have a different journey. We all have a different, obstacle, and mine happens to be myasthenia gravis. So.
I love what you said. I really love that. I can relate to a lot of it as well. I think for sickle cell, one of the things that there's so many, like Meredith said, there's so many, it's hard to choose one. I think the main one I would say is that you can meet like a number of different people that have sickle cell, that live with this condition, and it affects each of them differently. So how my sickle cell affects me and the complications that I have can be completely different to someone else. People can have sickle cell and absolutely go through life without having a really bad pain crisis or without having any forms of complications at all. And then you have the complete opposite side of the spectrum where someone can just, be constantly in and out of hospital, going through a lot. So it's really kind of a big difference when it comes to that. If I have to pick one, I think it would be the number of different complications that can happen as a result of living with sickle cell. I think a lot of people talk about the most common things that you'll see if you kind of Google sickle cell or something, which is like just the painful episodes and the hospital admissions and the fact that we can sometimes be taking so much medication to kind of mask the pain, etc. But as a result of the condition, it can lead to like organ damage, it can lead to like blindness, issues with your feet, issues with your breathing, like literally every organ in your body that requires blood, which is everything, can be impacted. And so it can go from severe to not. So I think the main thing that I wish people would understand is that it's a lot more complex than what people sometimes think. And by people, I also mean like healthcare professionals as well, which is the most frustrating part of it. But I won't get started on that.
We can always save that for later.
Oh, yes.
There's so many things. I feel like we should all just write a book together about this.
Now I'm in the publishing industry, so if this
don't
is
tease me.
Happen...
Let's talk about it.
Okay.
For me, I was having a hard time narrowing it down to, but one of the things that I'm told a lot is, well, I don't see a difference. And I wish that people would just take a little bit more time to learn about the emotional side of rare diseases and chronic illness, and to really take time to try to sit in someone else's shoes. I'm sure a lot of people listening have heard the type of stuff of like, well, you don't look sick, and like, well, what does sick look like? People who have thyroid eye disease may have a host of different symptoms, and some of them may be invisible. Some of them you might not be able to see, but it literally impacts how that person sees the world, because it can affect their vision. And for me, my most impactful symptoms that I struggled with were symptoms that changed my appearance, and they changed it pretty drastically. And so I've had 3 surgeries to try to correct some of the damage. And even then I still won't look like how I looked before. And I would do things to try to mask those symptoms, to try to help myself just feel a little bit more like myself. But still, when I heard people say, well, I can't see a difference, it just felt invalidating, because it was such a painful thing that really affected my mental health and really affected my sense of self, because I couldn't recognize myself in the mirror. So I think that these kind of talks are just so important, because the only way we can understand each other and, hopefully understand why those types of comments are not the most helpful.
Yeah.
To keep telling our stories.
I can relate to so much of what both of you have said. The 2 things that stood out to me the most were, well, one, Jessica, I'll reiterate the, invisible nature of many of these diseases, but both visible and invisible. It's funny. It's like for such a long time, when I was misdiagnosed, and even, in the early stages of when I was really, really ill, I had an asymmetric smile, or my one eye was drooping, or when I would speak, it would sound like this nasal quality, or I had slurred speech. And you have this body that you're living in, and it doesn't reflect who you are, or who you think you are, or who you're meant to be, or who you want to be. And that is really difficult to come to terms with. You kind of have to grieve the loss of your old self and adjust as your symptoms adjust. The waxing and waning of rare disease is so it can be very tiring emotionally. And then too, Jenica, when you had mentioned about not everyone the experience of a specific disease not always being the same, and that's so true. For someone with myasthenia gravis, we call it a snowflake disease, meaning we all share the same diagnosis, but it affects everyone so differently. And I think part of that too is because of the things we still don't know about this disease yet. And, there's a few antibodies associated with this disease, but there's some people who don't test positive, but still have all the symptoms, and those people are left hanging. And so there's still so much work to be done. And again, like you said, sessions such as these and having discussions about this is the first step.
Thanks, everyone. All such powerful sentiments. So moving on to our fourth question, which types of advocacy do you participate in most or enjoy the most? So for example, maybe it's a walk or social media, writing, speaking, so on.
I love all of it. I love connecting with people. I love writing articles. I feel like that when I was first diagnosed with thyroid eye disease, I couldn't find the articles I wanted to read. So I'm so happy to be involved with thyroideyedisease.net because I can create those articles that I want other people to find, so that hopefully others feel like there is a sense of community and they can hear from other people who have it and not just look at Google images nonstop. I also love connecting with people in person. I think that that's such a wonderful thing because like I said earlier, there's just a thing about meeting someone who has the same condition, because even though we all have different symptoms and different experience, there's some grain there that we all recognize within each other. And it is just instant empathy and connection. And I just love it. That's all.
Jenica, I'll let you go. I was talking a lot earlier, so I'll let you chime in.
That's okay. I would say definitely pretty much the majority of them. I started off writing. When I initially shared my first blog post, which was a couple of months before my book was coming out, which was years ago, and I'm an author, so yeah, I love to write. I found writing almost kind of therapeutic for me, so I would write about things that was happening after the fact or while they were happening, question why it was happening and all that kind of stuff. My very first blog post I kind of shared out of frustration and kind of feeling that everyone knows that I have sickle cell, but no one actually really knows what sickle cell is. And I didn't know whether this was to family and friends, were they actually scared to ask me, or was I not being open enough to feel like I wanted to share? So I kind of just blabbed it all out on a WordPress blog. And from there, I'd just been comfortable in sharing things that I'd been through. Also sharing other people's stories. So I created a community blog, and then obviously sicklecell.com is a thing thanks to We Go Health. So it's just, yeah, I enjoy most of them. I would say social media, but something that you'd mentioned, Jessica, earlier about not wanting to see yourself when you're going through a certain situation. I have realized, and a couple of people from the community have said, that sometimes it seems like everything's fine because I don't tend to share a lot of images and things of when I'm in hospital or when I'm going through things, or I had surgery and was on crutches, and I have absolutely no evidence of that. I don't like to see myself when I'm in that situation. It's not something that I like to remember. It's just something that I want to go through, get through, and get out of it. And I think everyone has their own ways of coping with with their condition. And that's just one of mine. And that's why I always say, like, create what you want to see, because for some people, they want to see the worst, you know, they want to see the reality of being sick and being in hospital and not being able to walk. And I don't like to hone in on that. I think a lot of whatever I share always ends on a positive note, or there's always kind of a positive message to it, regardless of whatever form of kind of advocating I'm sharing in. Yeah.
It's really interesting. I think that, you know, for me, I did that for a long time, and I always, you know, being the optimist, I'm always trying to end on a positive note, blah, blah, blah. And then, you know, then there are days when I am having a really bad flare, or, you know, my symptoms that are visible come out, and it's really hard for me to share that, but I do that in the sense that I have set this precedent for myself to be the most vulnerable, you know, as vulnerable and real as possible about the lived experience, or at least my experience with myasthenia gravis. And I kind of leave that to the, it gives me ownership, I'll say. It gives me ownership of those bad moments. And I can write to those images of me and my droopy eyelids, or my crossed eyes, or, you know, the drooping smile. It gives me a sense of control over something that is so out of my control. So I just wanted to speak to that, because I think, you know, we can all share in the similar experience of having visible and invisible symptoms, or, you know, advocating how advocacy work looks like even in those bad moments. And then to speak to advocacy, I, like you both, have also started in writing. It started small. It started very similar to you, Jenica, as, you know, venting and more of just wanting to tell my story, like finally get out the real stuff that was happening, because so many people had assumptions or judgments or whatever in their own minds. I'm like, no, this is my story to tell. So it started out as writing, and then I started speaking on behalf of, you know, different nonprofits. In college, I spoke on different panels, and then now it's taken the form of writing, speaking, social media, and now consulting. I work with so many biotech and pharmaceutical companies that are interested in, like I said before, gaining insight into the patient experience, which is just so tremendous. And I think it's also helped removing some of that stigma associated with pharma that we all, you know, big pharma. And what I like, I don't do anything that I don't believe in. I don't participate in anything that doesn't sit well with me. And, you know, I make sure they're my words and my, you know, my perspective, because that's the most important, right? And that leads me to thinking about, like, if people were interested in getting into advocacy, I think advocacy looks different for so many people. I think even just sharing your experience or sharing someone else's experience, like you said, Jenica, gosh, that's advocacy, like, in itself. I didn't even, like, you might not necessarily consider advocacy, but wow, sharing other people's stories, or sharing, you know, other people's experiences, that's advocacy work. If you just start small and it continues to grow, and then look at us today, like the three of us are on a panel. Had we never would have probably been met otherwise. And that's so powerful. It's a privilege, truly.
Anything else on that question? I love what you all said, and especially about ownership and having ownership and using your own words, Meredith. I think that's really powerful. And I'm so glad the three of you are here and sharing your experiences. And I hope everyone listening and also feels the same way. And I'm sure they're grateful to have the opportunity to listen to you and hear about different perspectives living with a rare disease. So our final question, and then we'll move to our Q&A section. So when you're having a tough day emotionally, what are some things you do to get in a better headspace? Or maybe not get in a better headspace, but just what are some things you do on a tough day emotionally? Maybe if you're dealing with some of those maybe negative internal conflicts?
I'm glad that you said to get out of it or to not, because sometimes I've had to learn to, sometimes I would say, I think just accepting how I'm feeling. It's something that I've had to learn to do. Like you were saying, Meredith, it's so easy to be like, oh, everything's fine. And, and people say like, even if you're feeling bad, look in the mirror, I am feeling great and I'm feeling this. And I'm in the mirror like, this is a load of rubbish. Like, everybody be quiet. I think for me, I just accept how I'm feeling and I've learned to be okay with it. I say to myself, it's okay not to be okay. It's just not okay to stay there. So I give myself time, I give myself a day. If I'm feeling like, you know what, today I don't want to get out of bed, or I don't want to speak to anyone, or I don't want to communicate, and then I just don't. I have a group on my phone of kind of like the nearest and dearest, or the people that if they don't hear from me, they may panic and think something's wrong. And I'll say, this is the day that I'm having, just leave me, and that's it. So I think for me, sometimes it's just staying in that day for as long as it takes. And I think that could be I don't know if I should call it a side effect, but it could be kind of like the opposite of my outlook on a day-to-day basis being so positive, that sometimes I have those days and I'm like, well, today's just going to be a negative day and that's okay. And I just allow myself to have that time. But I think that's just my coping thing. I have found in the past that it's, I've had times where it's been a day and it's been 2 days and then it's been a week, and then it's like, okay, you know what, I think maybe I need to speak to someone, or maybe I need, help. And it's understanding yourself and knowing yourself and realizing if you have a pattern, if something's kind of not going in the right direction, then being aware of that as well. But I think I'm quite in tune with myself to know that sometimes I just like to just not be okay, and I think it's fine to be like that.
I think that is just so real. And there was a day I remember I was walking through Central Park and I just said out loud to a friend, I'm not going to swear right now, but I just said, this whole thing has been traumatic. And giving myself permission to say that, I was really finally able to just cut myself some slack and just let myself realize that, yeah, this has been a traumatic experience and that is the reality of it. So I think that recognition and just cutting yourself some slack is so important. One of the, I try to do 2 other things. You might hear my cat in the background. Sorry, she's very upset right now for some reason. But one of the things that I try to do is that mirrors tend to be very triggering for me, and photos do, and old photos and new photos. And I found that different makeup techniques really helped me just feel a little bit more like myself. So if I was having a bad day, I would go into the bathroom and just spend like 20 minutes doing a little bit of makeup to help me just to try to connect back to myself while I was waiting for treatment. So that was really helpful. And then also I'm actually a yoga teacher, and I have a very like broad concept of meditation, because I don't think that meditation has to be sitting in a room and closing your eyes and then suddenly being one with the universe. I think that meditation can be a lot of things, like turning your attention from a million things to one thing. That's why I'm a big fan of cooking and of just getting out and going for a walk, getting physical to get out of your head. I think that all of those things can be so helpful. Knitting, just doing one thing instead of a million things.
Gosh, I hear myself in all of both of your, experiences and how you cope. I mean, it's giving yourself permission, that takes time, and that's a hard skill to learn, but it's something that I still, struggle with. It's hard to say, it's okay, or, I hold myself to this high level of expectation that I can I wouldn't necessarily hold other people to. And that could be just personality type. But like you said, giving yourself permission to not be okay is huge. And Jessica, I can relate on so many different levels. And then, yeah, meditation. I think when people hear meditation, they freak out, and I do it. I meditate every night before bed. It helps. And by meditate, I mean, I listen to a guided meditation and do breathing techniques, and, I'm to sleep like that, and just becoming in tune with your body, one with your breathing. That's meditation, that's self-care. And gosh, boy, do I love your your coping mechanism of doing the makeup. I can really that really resonates with me. And I didn't even think of it as a coping mechanism, but it truly is. And I am also love fashion, love interior design. Anything that brings me joy, I think is a coping mechanism. I think what's really difficult though is when my coping strategies often lie in productivity. However, when your body won't allow you to be productive or physically able to do so, it puts you in a really tough spot. And so not having control of that situation is really difficult, and learning to just be in that moment of struggle, frustration, about, be in tune with your emotions. And this is what it is. This is not how it has to be forever, but this is what it is for right now in this moment. Staying present. Power of now is really an important lesson to learn with rare disease, for sure.
Gosh, we're all so good.
It's nice to just discuss. I've learned so much already, so thank you. It's just an honor to be amongst you all.
Of course, yeah, thank you all so much for your thoughtful answers. Because of time, I think we should move to the Q&A session. So we got a few questions in the chat, and I'll just read them out. If you guys want to answer them, that would be great. So our first one is, it says, I have a number of rare diseases, most of which I had to diagnose before the doctors. Did you find that you became knowledgeable about other diseases because of the research you had to do?
Yeah, for sure. In my case, I would say it's not necessarily knowledge of the disease, because it was something that I was born with. However, there's something that I always say, which is I am an expert in myself, and I don't care what school you've been to, what level of education you have. There's no way that you can qualify in a subject called Jenica Leah, because I haven't even written it yet. So sometimes I think being in tune with you, it means that you know what's happening, and you can sometimes diagnose yourself and be like, hey, this is happening to me, or hey, I'm having this side effect. And for, sometimes given to kind of doctors and stuff, okay, they have a lot on their plate, or they're seeing a lot of patients, or they think they've seen it all and they haven't. So that's one of the important things about kind of being an advocate, I would say, or having to advocate for yourself sometimes, which can be so exhausting. But I had to learn how to communicate effectively with doctors in a way that they would listen. And it took years, and it's very frustrating. And you go back and forth, and it's tiring. But yeah, it has happened, and I think we've probably all been there. We know when something's wrong, or when this is similar to what's happening. And sometimes they can be so quick to shut you away. It's just like, we have to keep pushing.
Mm-hmm. I think it's just like all of that so valid. And it's important to remember that not every medical professional is well versed in every rare disease. Sometimes it's a page. That's Lila, by the way. Making an appearance. Not every doctor is well versed in every rare disease that's out there. Sometimes it's like a page in a textbook. And so when I was diagnosed with celiac disease, I had to ask for the test because I was going to doctor after doctor and no one could figure out what was wrong. And I had very classic symptoms of it. So when I asked, can I get tested for this? They said, oh yeah, of course, that sounds very much like your symptoms. And so I realized, okay, well, let me get well versed with what, potential complications are, because sometimes when you have one autoimmune condition, you're more likely to get another autoimmune condition. So I knew that thyroid issues can, be common in people with celiac disease. So I actively sought out an endocrinologist to ask for help, and eventually got diagnosed with Graves' disease. So being your own advocate and doing research so that you can at least ask doctors the questions, and also recognize when a doctor perhaps doesn't know as much as they let on, then you know when to search for a new doctor. I think that's really important.
Do you want me to say something, Sarah, or do we need to move on to the next? I'm just thinking about time.
Yeah, I can move on to the next one. We can always circle back too.
Sounds good.
So I think this is a great question. How have your significant others, or maybe just family, dealt with your struggles with the misdiagnosis? And what advice would you give to those who are currently in a misdiagnosis?
First of all, it's incredibly difficult to be in that space, and I empathize, but I've been there and I know what it's like. I know what it's like to have people doubt you, especially as a child, when you're at the mercy of others' authority. I mean, it was really difficult, but in terms of getting people to support you, I think just being, people also don't know what you're going through unless you tell them. And they can't read your mind. They can maybe see what's going on, but that may be only a part of the story. So being willing to be vulnerable, which takes time. I think you have to be vulnerable and be truthful to yourself, and share your feelings, and find people. And that might not necessarily be family members. Your support system can look differently among patient to patient. I think whoever you trust, whoever you think will have your back, and who really will also be, someone to support you throughout the entire process, I think is really essential. I'm not going to lie, like when I was a child, my family didn't know what was going on. And with a rare disease like myasthenia gravis, like those are so weird words, and it's like, I'm sure at times they doubted what was going on. It's easy to do. And I think just knowing that and being aware of that, these are confusing. This is, symptoms may overlap from condition to condition, but being patient, I think. And unfortunately, that's, one of the reasons our healthcare system is broken, is because it takes so long to get a diagnosis for some of these rare diseases. But by sharing, your experience, even during that misdiagnostic process, is so monumental that you could be helping others and you don't even know it. I mean, by sharing in that vulnerability and that experience, more awareness will be gained, and people will start to actually understand. But man, once that diagnosis hits, that it was validation for me. It was sincere and truthful validation, but then it was a whole other journey. So if you're going through the process of or if you're experiencing a misdiagnosis or can't seem to find the correct one, be patient, give yourself some grace, and find, as Jenica said, find your tribe, and educate yourself. And as Jessica said, advocate for yourself. It takes a lot of courage to ask for a certain test. And it took me a long time to say, well, do you mind testing me for this? Or, well, what about this? That's true advocacy. Self-advocacy is pushing those boundaries a little bit and being comfortable in that uncomfortable space, but knowing that it's going to get you a step closer to diagnosis is, you're your best lifeline.
I love all of that, Meredith. Thank you so much for sharing. And I know you do have a lot of experience with the misdiagnosis, so I think that was a perfect question for you to answer. So I'm just going to keep going because of time. So someone also asked, suggestions on waiting for results to come back. I have been searching for almost 2 years and my symptoms are really bad. I had a PET scan this morning and when they came back normal, that is extremely frustrating when you want answers.
It's such a hard process. I don't know if I have a good answer.
I say don't give up.
Don't give up. Don't give up. Keep doing your own research. Keep asking people in the community about things that you can then turn to your doctor and ask for those types of tests. I know that when I was first experiencing very scary symptoms of Graves' disease, my heart rate was 120 beats per minute resting. So just sitting down talking to you, I felt like I was running a marathon and I was really scared and I had to wait to see my next doctor and get a new doctor. And so I reached out to people in the chronic illness community and I said, here's what's going on with me. If anyone has experience with this, let me know because I want to go and show up to my next doctor's appointment super prepared and super informed on various conditions and knowing what to ask for. So I think that I tend to turn my nervous energy into something productive. So that's at least the route that I took.
A great tip, Jessica. Jenica, is there anything you wanted to add to that? If not, I can keep going.
No, I think Jessica, I think you kind of hit the nail on the head with a few things that you said. I'm not sure what specifically it might be, but sometimes I always find like with some results, it may be worth, if it's an option, getting a second opinion. I went through a process of having some tests done and they looked, relatively normal. But for someone that has my condition, even though it was slightly abnormal, that slight abnormalness actually led to something very serious, and sometimes can be the case. So if you feel like something's wrong and you have the option or the possibility to get a second opinion, I would definitely say that's probably something that I would consider doing, and that could be from anywhere. I'm based in the UK and my mum was calling doctors in the States, saying, has anyone heard of this? Does anyone, trying to get feedback? So sometimes it's worth the fight if you've got the energy or you've got the support system to help you through that. Then I would definitely say take that route as well.
That's a great call and another great way of just showing your advocacy, fighting for what you need. So I think this might be one of our last questions. So someone is asking, how does everyone manage with their finances and income while living with a chronic disease? When finances are strained, I think our health is affected by that stress and the challenge seems to be ongoing for me. Yeah.
Yes.
Well, we all agree
here.
There's no denying it. I mean, at least for me, that's been one of my main struggles and sources of stress, and it affects my physical symptoms tremendously. Living with an unpredictable illness, a sometimes invisible illness, a sometimes visible illness, a rare illness, a chronic illness, a neuromuscular illness. I mean, all these things have really affected how I work and what work looks like for me. I'm someone who is a hard worker, and so the opportunities in society has yet to catch up with what work may look like for me or for other rare disease patients. Again, it goes back to that thinking outside the box. I started my own business because no one was willing to accommodate me. It was only until 2020 now with this pandemic that people finally saw the value in remote work. And I had been advocating for that ever since I was, out of college. I mean, so I think it's a struggle. I am not going to, there's no denying it. That is the reality. I thankfully have support by other family members as well as my significant other, he's wonderful too in all aspects, but I mean, I don't want to be dependent upon others. That's not me. That's not who I am. I already have to depend enough on people for some of the physical things. And so it has really been a struggle emotionally and just mentally, trying to accept the fact that, but I don't give up, you know. I don't give up. I'm figuring out ways to make a living and be financially independent and also have health insurance, because as we know, having health insurance is key, but you can't have it unless you have a full-time job. I mean, it's part of our society and our culture. And if we continue to talk about it and bring awareness specifically about that aspect, things can change. And I believe that. I really do.
It is so important to talk about health insurance and how it relates to rare diseases and chronic illnesses, because for me, I know that my medical care during the pandemic was stretched out from something that would have hopefully originally have taken a year to do, stretched out to 3 years, which meant 3 out-of-pocket maxes instead of 1 year of that. And I said, oh goodness, that's so much more money. But I am in a place of privilege where I was able to cover that. But I know that a lot of people out there cannot. And when we think about access to healthcare and access to being able to get a second opinion and seeing different doctors, and the amount of time it takes for someone to get a correct diagnosis when you have a rare disease, it is so overwhelming and such a time-consuming and expensive process that it's so important to talk about and thank you for this question. It's so important to talk about affordable access to medical care, because if you don't have affordable access to medical care, you're probably just not going to get answers. And then there's going to be more problems later on. And so that's something that I'm passionate about talking about. So thank you.
If only people knew, like, if we had access to affordable healthcare, how much we could do, like, in all the other facets of our life, you know. It's so simple.
Mm-hmm. And how many and how less expensive it would be down the road if we just were able to get a diagnosis and get medical care in a timely fashion.
Right.
It's so true. Sometimes I think that maybe the healthcare industry doesn't realize that sometimes in what they do to make it so difficult for us, it actually becomes more expensive for them. Like, I could have saved you money too, as well as saving myself some money.
Right.
But one thing I will say, which you mentioned, Meredith, about the whole pandemic and everything becoming all of a sudden quite simpler, which was bittersweet for me. I was so very frustrated that all of a sudden everything moved online, when, you know, trying to find a position or a job role that would allow you to work from home was so completely impossible before the pandemic. And then all of a sudden it's like, oh my gosh, what a genius thing, let's use Zoom. Like it didn't exist before. So it was quite frustrating. One thing I will say is sometimes just be open and honest. I have in the past said to employers, like, if you give me a deadline, I will get it done. I might not get it done in the standard way that normal people do or that society sees, but as long as I do the job and within a certain amount of time, then just give me a chance. I think people are sometimes a lot more open than we think, or than we want to even admit to ourselves, maybe out of fear of just, you know, just saying it how it is. Sometimes it's quite hard to do that, especially when you're in the vulnerable position of being the person with the disease or with the condition. But if you can just like psych yourself up and say, like, look, this is what it is. This is how I'm going to do it. I'm going to get it done. Please give me a chance. I think some employers may actually just give you the benefit of the doubt. And sometimes we have to kind of motivate and give ourselves that confidence to say, hey, you know, I'm going to do this and I'm just going to get a yes. And you know, it may happen. There are some nice people in the world.
This is true.
How it looks right now. There are some nice people in the world that may just, you know, help with that situation. But I know it is hard for all of us financially.
All right, well, it's almost 5 o'clock. So with that, I think we're going to end the Q&A session. So thank you everyone for joining us today for the patient panel. We hope you found it insightful. And thank you again, Jenica, Meredith, and Jessica. We truly appreciate you sharing your perspectives with all of us. And just so you know, this will be recorded, or this was recorded, so you can certainly watch it later on. And then if you have any questions, I'm gonna put our email in the chat if you want to send them over. But other than that, I hope you have a great rest of your day, and we'll talk to you soon. Thanks again.
Thank you, everyone.
Thank you so much.
To
Happy
leave.
Rare Disease Day.
Happy birthday.